Hello, and welcome to the AZ Health Zone Early Care and Education Strategy Overview. AZ Health Zone is the name of Arizona's SNAP-Ed program and is funded by the USDA to improve health outcomes through nutrition and physical activity supports. The purpose of this overview is to summarize the early care and education system and strategy, often referred to as ECE, and the related activities carried out by AZ Health Zone state implementing agencies. We'll also briefly discuss the role of the State Implementations Team Early Care and Education Specialist. And finally, we will learn how to use AZ Health Zone's website in order to find tools related to the early care and education strategy. So what is early care and education? And how is the early care and education system supported by AZ Health Zone's early care and education strategy? Early care and education reaches beyond preparing children to enter the school system. It takes a whole child approach in meeting and developing social, emotional, cognitive, and physical needs and skills in young children. Lifelong learning and well-being are greatly impacted by early childhood experiences, and the early care and education system operates optimally when it seeks to build a solid and broad foundation and embraces the responsibility to establish and sustain policies, systems, and environments that promote and support the nurturing, learning, and development of our future citizens. The early care and education system are interacting parts, processes, and people directly and indirectly involved in the care, education, development, protection, and support of young children and their caregivers. Understanding this system and its desired outputs enables us to make decisions that will improve lifelong outcomes for children. Most central to the early care and education system is the child. Ideally, children are first and foremost cared for by their parents. The ECE system works best when it recognizes parents or primary caregivers as the child's first teacher and best advocate. Early care and education providers partner with families to care for, nurture, and develop young children. While pediatric providers such as primary care doctors, pediatric specialty therapists, behavioral health, and early screening and intervention programs are all integral to ensuring optimal health and well-being for young children. Child and family support programs and advocacy agencies provide resources, support, training, and much more for families with young children. While secondary, undergraduate, and graduate educational institutions educate the early care and education workforce and provide valuable research on best practices in child development. The child welfare and protective programs and systems help to ensure children are physically safe and that parents have the tools and resources they need to help their child grow and develop. Federal, state, and local agencies, policies, and regulations all may fund and or regulate programs to verify compliance and provide oversight to various programs and institutions within the ECE system. This is to ensure desired outcomes are met. While the early care and education workforce development agencies provide professional development opportunities and help to set standards for early care and education workforce. While this is not an exhaustive list of every person or entity that impacts the health and well-being of a child, it gives a brief overview of the various types of partners who may be able to partner with AZ Health Zone to further improve health and wellness outcomes for young children in Arizona. AZ Health Zone's ECE strategy is designed to support ECE systems in Arizona in order to improve health and wellness outcomes for children. This is done in partnership with early care and education professionals and organizations. Among many other supports, AZ Health Zone local agencies have the ability to assist with writing effective policies, sustaining equitable systems, and creating enriching environments that promote optimal and lifelong well-being by integrating trauma-informed practices through nutrition and physical activity programming and community engagement in the early care and education settings. So how do we do it? Through policy, systems, and environmental change, known as PSE change for short. PSE change is defined as a way of modifying the environment to make healthy choices practical and available to all community members. PSE change works beyond the individual level. You will hear about PSE changes often in AZ Health Zone. The SNAP-Ed federal guidance offers the following descriptions. Policies are written statements of organizational position, decision, or course of action. while systems changes are unwritten, ongoing organizational decisions or changes that result in new activities reaching large proportions of people the organization serves. Systems changes alter how the organization or network conducts business. While environments include the built or physical environments which are visible and observable, as well as economic and social normative messages and environments. To learn more about PSE changes and AZ Health Zone's overall approach, we highly encourage new SNAP-Ed staff to enroll in the Systems of Purchase for Healthy Communities online professional development program through the University of Minnesota. Contact us, the state implementation team, to register for instruction. Activities are specific ways to implement PSE changes. You can think of activities as different categories of early care and education systems work. We'll discuss 8 activities under the early care and education strategy and give specific examples of work within each one. The 8 activities in the early care and education strategy are Empower Policy, Learning Collaborative, Staff Development, ECE-Based Agriculture, Nutrition and Feeding Practices, Community Engagement, Community Coordination, and Physical Activity Environments. Let's start by discussing the first activity, Empower Policy. Early care and education providers enroll in the Empower program in order to improve the quality of care they offer. Providers pledge to adopt 10 standards that support healthy eating, encourage active play, prevent exposure to second and third-hand smoke, practice sun safety, and promote good oral health habits in exchange for reduced licensing fees. SNAP-Ed can come alongside directors and staff and provide technical assistance with writing and revising site-level policies that support implementation of 6 of the 10 Empower standards. The 6 standards that the SNAP-Ed is able to support are physical activity and screen time, breastfeeding, child and adult care food program, also known as CACFP, fruit juice, family-style meals, and staff training. Other kinds of policy work are also allowable. The second activity is staff development. This activity focuses on increasing ECE staff knowledge, abilities, skills, and improving practices. Local agencies provide training to ECE professionals in order to support the implementation of the Empower program. Train the trainers are another option for executing the staff development activity. It is important to note that only AZ Health Zone approved curriculum can be facilitated as a train-the-trainer. The third activity is Learning Collaborative. This activity focuses on convening a group of early care and education programs and/or professionals to participate in a learning system in order to make quality improvements in their centers. Local agencies can support learning collaboratives by providing training and consultation through the improvement process and providing technical assistance to participants when implementing and sustaining changes. With the Learning Collaborative activity, SNAP-Ed can come alongside multiple ECE providers to help bring together a community of learners, create a network of shared ideas and mutual support, provide access to high-quality resources for quality improvement, and offer opportunities to build important skills, implementation of best practices, nurturing a collaborative and productive ECE program team, as well as leadership and training. The fourth activity is ECE-Based Agriculture. This activity focuses on providing training, support, and technical assistance to ECE partners and staff to implement food education activities or events, establish and sustain site gardens, and/or support local food procurement. One way to execute this activity is to support an ECE with implementing any of the 3 farm to ECE components, which are food education, gardening, and local procurement. Food education refers to helping children understand where food comes from. Local agencies can provide this food education directly to children at an ECE site or train ECE staff to educate their students. Working with an ECE to determine their capacity to build and sustain an on-site garden is another way we can support farm to ECE. The fifth activity is nutrition and feeding practices. This activity focuses on supporting ECE partners in improving nutrition practices and environments, including breastfeeding, that are consistent with Empower standards and best practices. Local agencies can support ECE partners in providing nutrition and feeding practices in various ways. One example is to provide ongoing training, support, and technical assistance to an ECE partner who desires to create a breastfeeding-friendly environment. From the initial assessment to action planning to full implementation, local agencies have the privilege of walking through the whole process with ECE partners and adopting nutrition and feeding best practices. The sixth activity is physical activity environments. And this activity focuses on the support of ECE partners in improving physical activity environments that are consistent with Empower standards and best practices. Working with an ECE partner through the improvement process, from completing the self-assessment on current PA environment, to setting goals, to creating an action plan, to providing technical assistance with writing and implementing a physical activity policy, results in local agencies being seen as trusted voices and partners. The seventh strategy is community coordination. Community coordination involves the support of partners in writing policies, increasing resources, and expanding networks to meet an identified need. An example of this is partnering with a community stakeholder to conduct and/or participate in a community needs assets and data collection in order to determine needs within the early care and education community. Last but not least, community engagement is the eighth activity under the early care and education strategy. Community engagement is one of AZ Health Zone's foundational principles, and you will see community engagement as an activity under each strategy. The state implementation team defines community engagement as engaging residents in SNAP-Ed eligible communities in the process and planning using consulting, involving, and collaborating techniques. Work in the community engagement activity could look like one-on-one conversations, phone banking, tabling, surveys, community meetings, focus groups, town hall, consultations, advisory committees, and listening sessions, or other methods to understand how to best support SNAP-Ed programs and initiatives with the priorities of the community. And now that we've covered the early care and education strategy and activities, let's talk about the role of the focus area specialist on the state team. The AZ Health Zone State Implementation Team, or SIT for short, has multiple specialists working on SNAP-Ed goals in our state. These include 4 PSE specialists for active living, early childhood, school systems, and food systems, along with direct education specialists and a tribal community specialist. The role of the ECE specialist includes technical assistance, professional development, and statewide efforts. The specialist provides early care and education systems knowledge on best practices, research, resources, and connections to other experts. The specialist facilitates professional development such as trainings, workshops, conversations, and other learning opportunities to fill identified gaps, wants, and needs based on local agency feedback and reporting. The specialist also serves on state-level committees, leads working groups, and coordinates statewide projects as capacity allows. Lastly, if you are not already familiar with navigating the AZ Health Zone website, we will show you how to find tools and resources related to the early care and education strategy. From the azhealthzone.org, scroll to the bottom right and click Collaborators. Then click Childhood. You will see 2 section headers, one that says Strategies and the other one says Tools. To view a short description of all of the early care and education activities, click Early Care and Education. Below that, you will see the Tools section. Click View All Tools, and then you will be able to use the search function where you can click and find the tools. Tools are tagged by activity. So for example, you could type in the search box, Learning Collaborative, to find all tools related to that activity. Thank you for your time. We hope this brief overview of the AZ Health Zone Early Care and Education Strategy was informative and useful. If you have any questions or would like to connect about ECE work, please reach out to the Early Care and Education Specialist with AZ Health Zone.